A lot of patients first are surprised that it can be reversed. And the other thing that often surprises them is that it's not drugs that are the answer. The reason that type 2 diabetes insulin is affected is that when you eat, the insulin levels go up, and that allows the glucose in the blood to go into the cells. However, because people are overweight, the cells are already full. So even though the insulin is saying, hey, opens the door and allows the glucose to go in, the glucose is like, well, it's full. Just like when you go to a subway car, the doors might open, but if it's full, you can't go in. In response to that high blood glucose, it raises up and raises up and raises up the insulin, basically forcing that glucose into your cells. And as it forces the glucose into your cells, you start gaining weight. And that's one of the things that we see when we give people insulin is that they gain weight. Almost everybody gains weight as they take more and more insulin. So the disease is not so much that there's too little insulin. The disease is that there's too much insulin and the cells are sort of overfilled, just like the subway car can be overfilled. You can open the doors. If you produce more insulin, you can shove more glucose in by force. However, it doesn't solve the underlying problem. If you simply take more insulin, well, your insulin levels are already too high. So you're not going to make things better. You're actually going to make things worse. And that's exactly what we see in type 2 diabetes. As you give people insulin, they gain weight. And as they gain weight, they actually, their type 2 diabetes gets worse because we know it's related to the weight. So in type 2 diabetes, which is different from type 1 diabetes, the solution is not to give more insulin, which has been our traditional answer for many, many years. But in fact, if the insulin level's too high, you need an intervention which lowers insulin. And that's a low carbohydrate diet or intermittent fasting. So if you think about what intermittent fasting does, it lowers your insulin levels because you're not eating. Remember, when you eat, insulin goes up. If you don't eat, insulin's not going to go up. And what's going to happen? Well, your body's going to simply use up the glucose that's in the system. But the problem is that there was too much glucose in the system already. Just like when you have that subway car that has too many people. You got to let some of them off. When you do that, the next time the doors open, then the glucose can go in and you are able to use it normally. So that's the sort of rationale as to why low carbohydrate diets and intermittent fasting and exercise can all work together to get rid of the excess glucose in the system, lower the serum insulin, and get you back to normal, and that's how you reverse the disease.